The average age of getting a skin cancer is probably somewhere in your 70s. But we're seeing younger and younger patients every year. I think it's important to use sunscreen early. About 60% of all skin cancers are on the head and neck. But the other 40% are on the trunk and extremities. So you can get skin cancer pretty much anywhere you have skin. So skin cancer is thought to be the result of a cumulative kind of insult to the skin. It may be more than just like a single sunburn. Just over time, you get more and more exposure to ultraviolet radiation, and eventually you hit a point where you get a skin cancer. In the case of the most common type of skin cancer, basal cell cancer, it turns out to be this pearly colored bump on your face. It often bleeds, and it doesn't heal. People think they nick it shaving, and it just never heals, and it's slowly getting bigger. So something that is bleeding a lot, something that's growing in size. Squamous cell carcinoma comes in lots of different forms. It's the second most common form of skin cancer. It often presents as a scaly, like little patch. Sometimes people mistake it for a patch of eczema, little harmless keratosis, or a precancerous lesion called an actinic keratosis. It can grow almost like a volcano in shape and size. It forms this little mound of skin and has this very hard type of center, and it can be very painful and grow quickly. What you want to look out for is just something that doesn't look right. It's getting bigger, it's changing, or it has symptoms like pain. There are topical treatments for both basal cell and squamous cell cancers. In general, they're not nearly as effective as surgery, but in the right patient who might be, not wanting to undergo a surgical procedure, you can certainly try it for like a superficial form of skin cancer.